I'm Sarah Hart-Unger. I'm a pediatric endocrinologist at DiMaggio. I take care of children with hormonal disorders. I went to college at Williams in Western Massachusetts, and I went to do all of my medical training at Duke University in North Carolina. I am married to another physician. We have 2 children. When I was growing up, I knew I wanted to do something working with people. It didn't specifically start as being medicine. I had one thought of being a psychiatrist or a psychologist, and then at one point I thought maybe a dentist, but eventually, I became interested in science and realized that I liked to develop long-term relationships with people. So there you go, that's what medicine is. I became interested in endocrinology actually as an undergrad. I did some research on the effects of early life separation in mice actually, and we studied their hormones, and I became really excited about how powerful these little bloodstream molecules can be in determining behavior. And then I did my pediatrics rotation and realized that not only could I get to do all those things, but I could get to work with children, which made it a million times more fun, in my opinion. When I come to work every day, I hope that I can connect with my patients, that I can really listen to them and understand what's going on, and that I can do something to help them. You treat the family from the very first day, because our patients' conditions tend to be very chronic. We're not treating something that, okay, here's your pill and you're done. We are really involving the entire family in that patient's care, in the dynamic between the parents and the child. We are, of course, treating the patient and examining the patient, but we're also seeing, how are the parents dealing with this? Do the parents understand what's going on? How can we help them? And I do think that does reflect Memorial's patients and family-centered care. The babies who develop diabetes early, it's a really unfortunate situation, but it is a treatable situation. And when I get to see those patients grow up and 3 years later they're running around, and yes, they're on insulin, but they're thriving and doing well and the family's happy, that's just amazing, yeah. My promise for the patients is that I'm always going to listen to them, that I'm going to think as hard as I can about them, get others involved when needed, and try my best to provide the best care I can for that patient and family.